Hi, everybody. Thanks so much for joining us. I'm Dana Levinson, and we here on the DL are partnering now with AskTheDoctor.com, and we are launching our health and wellness series. AskTheDoctor.com has been doing this for a little while, but I am so honored and so pleased to be collaborating with Ask the Doctor and bringing you all the health and wellness information you need to know right now during this crazy time and what's happening. We are going to be speaking to a Toronto area dentist today. I'm going to throw on my glasses so I can see if Dr. Kotecha has made a request to go live. And yes, he has. He is going to be joining us in just a few minutes. Shammick, I'm waiting for you to come on. And when he does, he's going to be talking to us about oral
Hi.
health. Hello there. Thank you so much for joining us today, Dr. Kotecha. I appreciate you coming on and talking about a subject that I will have to say is probably one of the health issues that many people are not talking about during this pandemic, and that is our mouths. A lot of people are not taking care of their mouths right now.
It's the gateway to the body, and even though we're deemed an essential service, we're very limited in what we can do. So our goals have been really to try to keep people healthy in their mouths and keep them out of emergency rooms, because we don't need any more people going in there.
No, we certainly don't. And people need to know. We'll get to that. I think that's a very important piece in this conversation about what you do if you do have an oral emergency. But, you know, my mother always used to say to me, take care of parts of your body that people don't see. Right?
That's very important.
Smile, but you're not seeing, in between your teeth and the back of your mouth and your throat. And this is a very important part of your health right now. So what are you finding, or what are some of your patients asking about in regards to being in isolation, not being able to go see a dentist? What are they worried about?
Well, a lot of our comments are actually more from our routine patients. The routine patients tend to be asking more about their gums, because they're the ones who come regularly, get their teeth clean, get all that tartar taken off. Some of them are getting to the point where now they're starting to notice it. They can see the little yellow lines along the gums. They're asking us, is there any possibility for anything we can do? And the truth is, tartar is solidified plaque.
Right.
It's very difficult to remove once it's already there, unless it's done by a dental hygienist or a dentist. So we're trying to teach them prevention more than anything else.
So certainly not one of the sexier topics that we've covered here on the DL.
Probably not.
Certainly not very sexy to be talking about plaque, but needed nonetheless. And I think, it goes back to that old saying, brush your teeth twice a day, floss your teeth after each meal. What are some of the simplest things that we could be telling people right now, just the basics about oral health?
I mean, the key is always it all comes down to biofilms, not allowing bacteria to accumulate and then form plaque, which means the biggest thing is don't let food sit there. So brush twice a day, 2 to 3 minutes, floss as much as you can. If you're not a flosser, and not everybody is, there are other things you can use. They're not as effective as floss, but there are other things, like a water pick's a great tool. I have a lot of my patients using water picks. It's great when you have lots of spaces between teeth, and if you have significant dental work, bridges, implants, such like that. Interdental tools, there's little floss sticks you can buy.
But here's the thing. Sorry to interrupt you. Here's the thing. A lot of people they're not going to the store.
No.
Maybe they shouldn't be really. No. But if you're putting in your order and you're ordering things online, for sure, dental floss and dental picks, maybe throw that on your list tonight when you're thinking about your main list, if you're ordering things online, for sure. But could there be some remedies that you could provide? Tell us, other than the obvious, brush your teeth, floss your teeth, some remedies, maybe some of those old grandmothers' wives' tales about rinsing with salt.
Salt water is great. It won't help you with tooth decay, but salt kills a lot of bacteria, so it won't harm you. The only people that have to somewhat be worried about that is if you're someone who has really high blood pressure, then I would make sure your physician knows that you're going to be doing something like that. But the amount of salt we're using is so little that it'll help. There are other things you can't, you can order mouth rinses online where you don't have to go
Right.
into the store. Those are great. I mean, they're great for above the gums. They're not, the research shows they don't penetrate as deep as we want them to, but they'll do better than nothing.
Okay.
Uh, you know, and there's foods you can eat as well that will help you. Now, they're not on everyone's top food list. I mean, if you ask me, do you want a bag of chips or do I want to eat broccoli and cheese? I'm probably going to take the bag of chips, but
Really?
there's, yeah, oh yeah.
Broccoli and cheese happens to be absolutely delicious, and anything that is smothered with
And
cheese
cheese.
or any to me is delicious. So I would
So,
take the broccoli and cheese any day.
so that'll help you. Things like that. And, it's just also watch what you snack, right?
Yes.
If you're sitting at home watching Netflix, which a lot of us are, and Prime and all the other video subscription services, we tend to snack. So just make sure you're paying extra careful attention to those things. But
Because when this is all over, and God willing, it will be soon. One day it will be over. There will be a lot of things that we have to attend to. And
yeah,
one of the things that we are going to have to deal with is what has happened in our mouths. And I know for me, I was due for my spring cleaning
mm-hmm.
last week and my kids this week. So, you put things off until March or April. It's on your bucket list for spring, and our oral health happened to be one of those things. And so now it's been 6 months for some of us, 9 months for myself, since we've had proper cleaning, dental cleaning. So I'm a little bit concerned. I mean, I don't think I'm going to have tooth decay or any kind of rotting in my mouth. I'm fairly clean, but there are some people that are watching this and thinking, I have been binge watching Netflix, and I have been eating chocolate and raisins and cranberries, and even things that are considered healthy snacks still are laden with sugar, and you're getting those sugar buds in your teeth. So what are some helpful reminders? Because that made me think when you said Netflix and binge watching, people are also binge eating.
Yeah,
Right.
it's easy to do. I mean, you really just have to take extra care. You're at the end of your evening, you've watched, like for me, it was Ozarks 3. I was sitting there watching it, instead of just crawling and going to bed, make sure you go into the bathroom and brush those teeth and floss them and get stuff out. You got to pay extra attention this time, because you also want to, there's a lot more going on. You maybe just be cleaning your teeth, but, people are stressed.
Mm-hmm.
Because some are not working, some are decreased working, and all the other craziness that's going on in our world. You just got to take extra care. You got to take extra care of your whole body, and that includes your mouth. Like, sleep enough, go through your regular routine. I think that if you're just, unfortunately, just taking care of your teeth isn't going to help you, but there are little things that you can continually do. I would, instead of brushing once, for 1 minute, do 2 minutes. I mean, I know not everyone does the 2 to 3 minutes that we recommend. We know that. Pay extra attention just so you can stay healthy. You want to keep your body as healthy as you possibly can.
I want to tell everybody who's joined right now that we will have a moment in a few moments where people can ask you some questions, because I think that's important as well. But I want to hit two ideas here. You talked about routine, and I think that's really important. And we're talking about certain foods. So let's talk first about foods, because there's been a lot of talk about eating right during self-isolation, making sure you're eating healthy. And one of the things that I've been doing a lot of, and I know it's not great for my teeth, is drinking lemon water. So I'm putting lemon.
How much lemon water do you drink?
Probably too much. Probably too much. I know that when I go see my dentist, when this is all over, he's probably going to say to me, you've been drinking too much lemon water. So I'll have a couple of wedges of lemon in my water a few times a day. Is that too much?
Depends on what type of person you are that you drink. Like, some people they drink and they'll just guzzle it. Not nearly as bad for your teeth. And then there are other people that savor it. They'll drink it and they'll enjoy, like when I drink, for example, different drink, but same philosophy, coffee. I love my coffee, and I drink it to enjoy it, not for the caffeine. Well, one of the things I tell my patients is I tell them, after you're done that beverage, go rinse your mouth with water. Don't take a toothbrush to it, because if you've actually because both coffee and lemon water are acidic. if you take a brush on something hard and you scrub it, that's actually worse in my opinion than if you just rinse your mouth with water and wait for about half an hour to brush your teeth after
So
that.
wait, after I've had water, I have to rinse with more water?
I would. It just increases the pH.
Wow. Okay. What about alcohol?
Well, alcohol, I never really, I don't think I don't drink enough for it to matter, but if
You
red
know,
wine,
you may not, but there's probably people watching this that have probably enjoyed
yes,
several more glasses than they usually do.
probably, that is
Yeah.
the one thing during this time, yeah, nothing, rinsing your mouth out and not letting the stuff sit on your teeth for a long period of time is never a bad solution.
Here's the thing. I used to say this, that if your teeth turn a different color from drinking something or eating something, you have to get rid of that color in your mouth.
That
So
is
if you're
very
drinking
good.
red wine and your teeth turn purple,
Yes,
you might want to go rinse your mouth.
I would agree with you on that. That would be that's very good advice.
Yeah.
Very, very good.
Well, who am I? I'm not a dentist. I'm just a
No,
mom.
simple things make simple sense. Make sense to
when
me.
your kids are walking around and have chocolate in their gums, you're like, you got to go rinse your mouth because it's sitting there, right?
Yeah.
So,
my daughters get lectured on that all the time.
oh, that's good. That's very good. So, and then we were talking about routine, and the reason why I'm asking you about routine, and interestingly enough, you're a dentist, and again, part of keeping your health and your wellness at an optimum right now, what has been recommended is to stick to a routine. And yes, you're going to have days where you want to stay in your pajamas, for hours, and you don't want to get dressed and showered and do everything that you normally do first thing in the morning. But what that means is you may have put off taking care of your mouth. And I've seen that with my kids. So when they have asked, can I stay in my pajamas a little bit longer? Did you brush your teeth? Like, I'm on them. Have you brushed your teeth? Have you brushed your teeth? They're like, oh God, Mom, stop.
Imagine my kids. My kids, they get asked like 3 times a day.
No, I can't. So what do you say to that? Because we have to relax on something, right? Yeah. We can't be on the kids like constantly every single day about everything. That's the advice that's being given by all professionals. But we don't really want to let up on oral health too much.
No, I mean, it comes down to, we have to, as a parent, we all know you have to pick your battles. For me, with my children, I get the routine is really important. If you keep at least I don't supervise them brushing their teeth in the morning. I let them do that. And then I'll supervise them in the evening. Now, my kids are 6 and 10. The 10-year-old's getting pretty sufficient, but still, that's when they start, 1, 2, put it down and be done. So I think, if you're you can't harp on them all the time. So if you can make sure they brush before they go to bed is the most important thing there is, because you're much more susceptible to tooth decay at night than you are at any other point in time because your mouth gets dry. And even those people, I routinely on any new patient that I see when we go through an exam, we ask about brushing, and I'm pretty upfront with them. I'm not going to lecture to them. That's not my style of practice. If they're going to brush and floss, they're going to brush and floss. There's nothing I can say or do to make them, because people are grown adults. But I find that one time people don't brush, they'll always brush in the morning if they brush, but they rarely brush at night. Oh. And we see it all the time. How many times do you brush a day? Once. Morning or night? Morning. Twice. That nighttime is what keeps you out of my chair. Because that is when you've notoriously had a later night snack that you shouldn't have had, and then you go straight to bed. That sits on your mouth in the worst period of time. And
there's so much of that right now, right?
Yeah, because you're tired. A lot of us are watching a lot of TV, and it's easy to do that because you're just like, oh, I just want to go to bed. But it's really important.
What do you think people could do if they had a dental emergency? Because we know going to an emergency room right now is not the best thing.
So, there's some guidelines. It depends where you are in the world. In Ontario, where we are, the Royal College of Dental Surgeons Ontario has some guidelines. Dentists are considered essential services. there's basically 3 or 4 reasons why your dentist should see you. Now, before I say that, I'm going to say that not all dentists are open at this time, because we're required to have a certain amount of PPE equipment. Many of us either have ran out because we're not a priority right now, or we have donated it and don't have it anymore. So many of us don't have the facility to actually have you seen. That being said, if your your dentist should still have someone or themselves answering the phone.
Oh, really?
So if you do have a true dental, now some of them by email, because some dental offices have no staff at this point.
Right.
So as a dentist, when I get a call from a patient of record, someone who's a patient of mine, I'll go through a triage. Our college has listed 4 areas where they think that would be determined what they quote an emergency. Trauma is the first one. So if you have any trauma to the face, any of your teeth are broken, you bit down on an olive and it cracked your tooth. I mean, those are what we see all the time. So that's an emergency. If there's an infection, either a gum infection, a swelling from a tooth, wisdom tooth got infected, children got an infection, those are considered an emergency.
But where do you go for that emergency? You call your dental office.
You should call your dental office. There's 2 more.
Okay.
Bleeding. So if there's uncontrolled bleeding, now I assume that would have to be after a procedure or you injured your mouth, so I think it would qualify regardless. And the last one is severe dental pain that cannot be managed by over-the-counter medications such as Advil and Tylenol. So one of those 4, so if you call me and we go through, you tell me the history of, I have a sore tooth on this side, it hurts at night, it's swollen, I would diagnose it. If I think it's a dental infection, I can call you in a prescription for an antibiotic and then manage you that way. My office at this point is not able to see patients as we don't have the proper PPE right now, but there are offices listed on the Royal College website that list all the dental offices that are able to see patients for emergency treatment. And they're going to ask the same questions I asked. It's easier if I triage you and then send you there, because then they know that it's already been triaged and not just a random phone call.
Right, which is very important. We want to tell people that your first call is, really, if it's not that true emergency where your face hasn't been, swollen. God forbid something happened to your face, like an accident, you need to call your dentist first. You're not heading to an emergency room.
Yeah, the goal is to stay out of there.
Yeah, you don't want to go there because they probably won't see you and they won't help you, right? They're not going to give you what you need.
And there's a large number of offices on that list that are able to see people. The goal for all of this is the Ministry of Health doesn't want dentists to create aerosols. So anytime we have to use a drill, we realistically can't function. We can't work. That's why you can't get your teeth cleaned. There's a whole bunch of reasons, but one of the reasons they don't want aerosolizing viruses is not a good habit to have. So they've asked us. So once it needs a drill, you need to have all that protection, and there's only certain offices that have that.
Will you tell me, if you can, briefly tell me what should people be looking for themselves for their oral health and their children in terms of a red flag? So of course bleeding is like if my kids are flossing and I see blood, obviously we know there's a sugar butt in there, there's something going on. What should parents for themselves looking for their kids right now?
Okay, so let's start with parents themselves. So adults, if they have if you have signs that you have a tooth problem, you can have spontaneous pain where it just hurts on its own.
Right.
Obviously swelling, if you have your face swells up. You could also have swelling just inside the mouth where you don't have swelling where it's visible, and one of the things your dentist may ask you to do is, can you take a picture? And some tricks on that, I'll just briefly talk about that, is you can actually use a spoon. And if you take a spoon, you can actually retract your cheek fairly far and just make sure the flash is on your iPhone camera.
I'm visualizing that.
Yeah, and I'm going to go in a little bit in a second. Orthodontists also have something like this. But so that's one thing you do. They may ask you to take a photo. You can send that to the office. Other thing is if you have something sweet and the pain, sweet or hot, and the pain doesn't go away, it lingers for more than a minute, that's usually a sign that the nerve inside that tooth is in trouble. Now, cold sensitivity, which is the most common complaint, can be caused from lots of different sources. So it's not necessarily something that if you called your dental office, they may not say that is something that qualifies as a true emergency. So the spontaneous pain, the prolonged pain to hot and sweet, and obviously swelling are tooth issues. And then, for children, it's a little more complicated because kids don't always tell us what they feel. So one thing I have seen over the years, if a child has an infection, is when they're chewing, they'll move the food to the other side. So, if you had a younger child, say a toddler, and you gave them a cookie or a cracker and they bit into it and you saw them swap it over to the right side and bite down, or the left side, and bite down, they may have something going on their front teeth. Just lift up the lip. That's one thing you can do to look. Sometimes they have a fever that's you can't figure out where it's from. I mean, at that point, I'd also call your family physician because they're going to help a lot too.
Right.
But kids are tough. We've had cases right now where I have 2 locations, and one of my associates called me asking me, a mother wanted her daughter complaint was every time I chew, it hurts. And we can look back at the old, because they're a patient of record, we can pull up their radiograph or x-ray and see that they have some decay that was treatment planned but can't get to it. Now the question comes, is that considered a true emergency or not? And
well, during COVID, right, that would not be considered an emergency by any means. We're just trying to ward off the emergencies, right? We're trying to get people, we're trying to inspire people to take care of the inside of their mouth, so they don't have an emergency in a week from now, right? Or they don't, right? That's really the point, right? We're really hoping.
I totally agree. Prevention is worth a lot in this case. Plus, we don't want people out. We want them in the house.
Exactly. Exactly.
Stay home.
Let's start tonight, everyone, by making that list of things that you need, right? That you can order online or with your online, right?
You can order. There's so much. Now you have to be careful. There's lots of, you'll search for toothpaste. The next thing you know, your feed is full of all these toothpaste from everywhere in the world. Not everything is applicable. No, be careful.
Someone had asked, what about Scope with a question mark? Scope, okay?
I personally don't like Scope. That's my own personal thing.
Okay.
My routine mouthwashes that I like people to use over the counter are Listerine is my gold standard. Look for anything with Listerine is and then Crest Pro Health I like Colgate. Look for anything with the Canadian Dental Association seal. That makes a big difference. I don't know if Scope is if people like it, that's fine. It's not my first choice.
It's not your go-to. Okay.
No, I don't think it penetrates deep enough to do anything.
Okay.
But that is only my opinion. That is not.
Okay. So you're telling everyone tonight, make your list, right? You're making your online list, your grocery shopping or wherever you need. Think about your mouth. Think about your mouth. Just think about your mouth. Just take a moment, pause, and think about what are some of the things you don't have in your home right now that will help your mouth. The second thing is, if there is an emergency, you really need to just, again, take pause and think, is this really an emergency or not? And you can call your dentist, and then they will help you, decide if this is a true emergency and you need to see a doctor or a physician in an emergency room. Probably not, but
I agree.
They will. And then again, we want to remind everybody, please brush your teeth.
Yes.
Please wash your teeth. We don't need, the rush of appointments to the dentist when this is over, you're going to be very busy. You know that, right?
Hopefully. I'm getting bored sitting at home. So.
Well, my dentist's office had called and rescheduled, and now we have to reschedule again, and probably we'll have to
We've done that too.
again. And my poor son has had his braces on for 2.5 years.
Let's talk about ortho.
And he's supposed to. Today was the second in a third, 3-part series to have them removed. So he's really bummed.
There is one more thing about orthodontics I should mention.
Please.
Or there are orthodontic emergencies. They fall into the category.
Yeah.
If a wire is broken, it's cutting your cheek. The orthodontists are very good. My instructions for how to take photos in the mouth with a spoon came from my daughter's orthodontist. So
take note. That's fantastic.
There's also a lot of push for virtual consults coming on,
Yes.
where there are a lot of dentists doing them. There are a lot of platforms you can look up on how to, if you have a question, there's lots of places to ask now.
So you've incorporated quite a bit of technology and forward thinking in your practice.
Yeah.
How are you utilizing all of that now?
Well, I mean, I've done a couple virtual consults where I've just used FaceTime. Someone just had a question and I just FaceTimed them and was able to answer it. Most of it, and I will tell you, were parents whose children have had issues and they just want reassurance. Yeah. And if I had to go in, and I can't anymore. I ran out of the PPE. I did go in a couple times because I had the appropriate stuff, but we just don't have any more left because it's all just fine. And you can't do anything about it. You can't get it. So
dentists are people too, right? You're humans. You have families. You are not going to take that risk. There's no, you can't, right? So people have to understand that as well. Is there anything that we didn't cover that you think that people need to know?
No, I just think that, well, there's one other thing.
Yeah, please.
Your body the mouth is connected to every part of your body. It's the first thing. If you're not eating and sleeping right, if you have teeth that are borderline, you're going to push them over to become a problem. So if you're someone you should sleep well, eat better, because it'll help your body fight off any of those dental issues earlier. So even if, just take care of yourself. It's not a dental issue. It's a human issue.
It's the gateway. Is that what you called it? The gateway?
It is the gateway.
It is the gateway. Thank you so much for joining us today.
No, no problem. My pleasure. Anytime.
It was really, I want to say it was delightful because we really, on the DL, we've talked about some pretty heavy conversations. And while this isn't heavy, candid, or sexy, it's really informative. And with AskTheDoctor.com, this is a fantastic partnership to really bring health and wellness into everybody's life. So thank you.
I say this facetiously almost, but I'm sure everyone would love to have their conversation with their dentist through a computer screen, so they don't have to go see them.
For sure. My kids, 100%. 100. I like the dentist, I have to tell you. I appreciate the way my mouth feels. I love it after I come out of the dentist. I love the way it feels. I was very bummed that my appointment was canceled, obviously. Mm-hmm. And I love the way my gums feel. I do have that salt cleaning. I've had that done a few times. I love the way that feels. So it does. It's refreshing. I can't wait to go back to the dentist. It's on my list of things. Trust me, it's on my list of things. Mid-May, earliest, I've heard. Where can people connect with you if they want to connect with you? They can find me online. I'm a couple different things. They can go on my Instagram, which is Dr. S. Kotecha 99, and then they can look me up at www.sgvdental.com is my office website. Okay. And I also have a study club called the Kotecha GPS Club. They can YouTube that. I've got videos coming on that. Okay. It's more geared towards dentists, but if they want to learn it, that's fine. You never know. The budding dentist somewhere out there. Thank you. Thank you so much. And I hope everyone in your home stays healthy and happy. And I want to thank everybody for joining us today. And we will post this and repost this. So if anybody wants to find you, they know where they can find you as well. No problem. Thank you so much. It was lovely to virtually meet you. You too. Thank you very much. Take good care of yourself. Thank you. Thanks, everybody. Bye-bye. Take care.